Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar, and this is Big Discussions 76, Science and Technology. First of all, please like this video, please share it, and please subscribe to my channel. Well, I'm back with yet another coronavirus slash COVID-19 video slash discussion. This one, as opposed to looking at hard research data or data from the clinic, this is going to involve data from the CDC looking at infections and who's more susceptible to infection. And there's, a lot of talk and deliberation about that, especially when thinking about reopening the economy, sending kids back to school, and also in the Big Ten conference when discussing whether or not to allow the student athletes to play football. So that's the overarching question of this thing is who are the most susceptible populations and what's the overarching concern. There's been so much misinformation and conflicting information regarding this whole thing, and I was actually having a discussion last night with Nicole Ali and Don Calypso and Brother Xavier. So I found this article and I thought that it was worth capturing here on Big Discussions 76, Science and Technology. So this article comes from the Western Journal, and it's entitled CDC Now Says 94% of COVID deaths had an underlying condition. It was written by Jack Davis and it was published on August 30th, 2020. And the article reads as follows. A new report from the Federal Centers for Disease Control and Prevention shows that in 94% of the cases of those who died from COVID-19, another disease was also at work on the victim. For 6% of the deaths, COVID-19 was the only cause mentioned, the CDC stated in its report under the heading Comorbidities. For deaths with conditions or causes in addition to COVID-19 on average, there were 2.6 additional conditions or causes other than death, the report continued. The report showed that in 18,116 of 42,587 deaths in the 75 to 84 age group, the individual who died also had the flu or pneumonia, while in 15,100 cases, the underlying condition was respiratory failure. Overall, the 161,392 deaths covered by the report, overall of the 161,392 deaths covered by the report, 42% or 68,004 of those who died also had the flu or pneumonia, while 34% or 54,803 had an underlying condition of respiratory failure. Diabetes was an underlying condition in 16% of the deaths, or 25,936 people, while various heart-related conditions, including cardiac arrest, ischemic heart disease, also known as hardening of the arteries, cardiac arrhythmia, and heart disease, in 58,687 people, were found in 36% of those who died. In June, the CDC listed as high-risk individuals for COVID-19 those who had chronic kidney disease, COPD, also known as chronic obstructive pulmonary disease, obesity, That's considered a BMI of 30 or higher, immunocompromised, in immunocompromised state, a weakened immune system from solid organ transplant, serious heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, sickle cell disease, and type 2 diabetes. Although the CDC's initial guidance suggested those over 65 were at high risk, the CDC later revisited that note. The CDC later revisited that to note then risk increases with age, and that there is no single age at which risk suddenly rises. I'm going to read that paragraph one more time because that read kind of awkwardly. Although the CDC's initial guidance suggested those over 65 were at high risk, the CDC later revised that to note that risk increases with age, and that there is no single age at which risk suddenly rises. In comments released at the time, CDC Director Robert Redfield said, "Risk is a continuum." Based on what we've learned, we now understand that as you get older, your risk for severe disease, hospitalization, and death increases. We also updated the list of underlying health conditions that can put you at higher risk for severe disease, hospitalization, and death based on the latest review of scientific evidence to date, he said. A key point is that we want to make sure that people know that as your numbers of underlying medical conditions increase, your risk of severe illness from COVID also increases, he said. As of Sunday afternoon, the coronavirus had infected almost 6 million Americans, according to the Johns Hopkins Coronavirus Resource Center, and roughly 25 million worldwide. As of Sunday, 848,826 people had been reported as killed by the virus, with 182,909 of those being Americans. Spread of the disease resulted in mass lockdowns across the country. Risk is one of the factors that will go into distributing COVID-19 vaccines once those that are now in trials are ready for the market, according to CNBC. At first, there will likely be a limited supply of one or more of the COVID-19 vaccines because limited doses will be available, Redfield said on Friday, CNBC reported. It's important that the early vaccines are distributed in a fair, ethical, and transparent way. The list of those to be vaccinated will include healthcare workers, those considered essential workers at the time a vaccine is ready for distribution, and those considered at high risk due to age and underlying health conditions, according to the CDC. So I'm going to leave this article in the description box below so you can read it for yourself. Again, there are multiple fronts on which this battle is being waged. One front is at the workbench in terms of basic research. The other is in the clinic, and also the other is at agencies like the CDC and the NIH, where scientists are poring over the data, looking for trends, and trying to tease out who the most susceptible groups and populations are. And so we can look for more data like this to emerge as time goes by. And knowing who those most susceptible populations are will help with the more nationwide decisions in terms of reopening the economy, sending kids back to school, and allowing for things like attendance of athletics and concerts and those kinds of things. So I'm going to stop this here. Please let me know what you think in the comment section below. I'm not familiar with this journal or this publication, WJ News. I think that in today's, it's the Western Journal. I think that in today's era, we also have to be cognizant of where the information is coming from. So I'm not familiar with this. It came to my phone, but I thought it was worth capturing here on my channel. And we all have to look at the information we receive with a healthy sense of skepticism and not take things at face value. So I'm going to stop this here. Let me know what you think in the comment section below. Please like this video. Please share it. And please subscribe to my channel. And as always, remember that your attitude determines your altitude. Take care, and I'll talk to you the next time. Bye-bye.